breast care nurse is your single most important friend.
There's 3 things I say to patients. One is listen to your body. You know you. You've lived within you for a very long time. You know the difference between period pains and tummy ache. You know when something's right and when something's different. You know when you get hot flushed, when you've got an infection. Don't ignore it and think that'll get better. Acknowledge that this is something and it's not quite right for you, and then seek help. And just call us. And it's no bother. You're not being a hassle. You're not being a pain. You're not being extra work for overrun nurses. None of that.
I had a fantastic breast care nurse who got to know me really well, and the relationship was such that you could go and share your concerns with her. I landed up not phoning them at all, but they did emphasise it to me, particularly because I have a nursing background, and they said to me, however silly the niggle is, you must ring us up.
Invariably, people don't ask until you ask them something. So, and you phone about something else, and then 5 minutes into the conversation, it'll be, oh, what can I eat? Can I have an ice lolly? Can I have a cup of tea? I'm going to the toilet slightly more than usual. My poo is slightly different. My hair's starting to come out. I've got a tingly feeling in my head. My fingernails feel a bit funny. I think my fingers feel a bit numb on the ends. I can't sleep. It could be anything.
I'll go to an appointment, especially with my breast care nurse, and I'll tell her that, okay, you know what, I've got this issue, I've got this issue, I've got that issue. But then I'll forget the most important thing I went there for. And then when I get home, I'll be kicking myself. I forgot. So I had to learn and keep learning to write things down, because your memory is not going to be as reliable as it used to be.
I have some patients that need small amounts of information, but I have other patients that need lots of information regarding not only their treatment, but also how they can manage as at home socially with young kids, or maybe have financial issues, or have family problems as well that need to be sorted so they actually get through their chemotherapy journey in a reasonable format.
I'm kind of quite a carefully emotionally controlled person. There was one occasion where she saw I'd got something on my mind, and she said, look, you need to talk to me about it. And I did, and I felt much better.
My breast cancer nurse was fabulous, nagging me to make sure that I did my exercises after the operation. Just lots of support and advice.
अनपुटन होना नर्सां जेह्ड़ियां चंगियां गुड होन गुड लुक आफ्टर करन ते बंदा हैप्पी रहना हैप्पी माड़ियां नर्सां बहुत चंगियां सी मैं मेरी प्राउड सी उन्हां वास्ते नर्सां डॉक्टर वास्ते जिन्ना माड़ा ऑपरेशन किया इलाज किया नर्सां सपोर्ट की मैं बहुत खुश हाँ हैप्पी सी उन्हां वास्ते.
She was guiding me through my life. Are you walking 3 times a day? Are you doing this? Are you doing that? Don't forget to floss your teeth. Make sure you made an appointment with the dentist. All those little things about your lifestyle, they were there checking. But once I'd finished radiotherapy, it was a really strange feeling as somebody had let go of my hand. A lot of people think, oh, I don't want to trouble them, but pick up the phone.
We want to be able to try and help you, and even if there's nothing we can do for that particular one thing, it's something that only time will get better. We can at least tell you that to give you comfort that this will pass and that you will come round from it the other side. So ask. Don't put up with stuff at home. Just ask us.